On this episode, I talk with Suicide Prevention Australia's CEO, Nieves Murray. We talk about a whole range of topics, including, of course, the virus and mental health. We talk about Australia's response to the virus, what the Australian government is doing alongside her organisation, social distancing versus physical distancing, people's true colours showing during a crisis, and there's also some questions at the end of the second part that you'll want to stick around for. And with that, I guess let's jump straight into the show. I'm Hayden Perno, and this is the Penosophy Podcast. So here we are again, once again with the most requested guest of the Penosophy Podcast, Mrs. Nieves Murray. How are you today, Mrs. Murray?
Well, thanks, Hayden.
She is, if you've listened to, I think it was episode 24 when we last spoke, she's the CEO of Suicide Prevention Australia. She was a psychologist back in the day. Now she just works in the organisation trying to change the entire nation to make sure people are aware of suicide more and to hopefully decrease the prevalence of what's going on around the world, especially with a crisis such as this. I'm sure you have been working around the clock dealing with different regulations that have been popping up and things that you guys are going to have to put into place to make sure the severity of it doesn't peak so high?
Yeah, certainly any crisis, I think, adds distress to anybody's life, but most particularly when we're seeing people in isolation and for a protracted period of time, that level of solitude and isolation increases a person's distress. There's lots of research that indicates that being lonely or being alone can have the same health effects as smoking a packet of cigarettes a day. And, that's a pretty frightening statistic. So to know that people have been in isolation for a protracted period of time, I think, does highlight some of the mental health concerns that we can anticipate will occur as a result of the current crisis.
Hope so. I'm going to share my screen. You can see YouTube, yeah?
I can.
Have you seen this particular talk Governor Cuomo did over in New York, when Trump talked about the cure not being as bad as the illness?
No, I haven't.
So we'll start with this.
I don't know if you can hear, but there are protesters outside right now honking their horns and raising signs. We did speak to a few of them before we came in, and these are regular people who are not getting a paycheck. Some of them are not getting their unemployment check. And they're saying that they don't have time to wait for all of this testing and they need to get back to work in order to feed their families. Their savings is running out. They don't have another week. They're not getting answers. So their point is the cure can't be worse than the illness itself.
Yeah.
What is your response to them?
The illness is death. What is worse than death?
Well, what if somebody commits suicide because they can't pay their bills?
Yeah, but the illness is maybe my death as opposed to your death. They said the cure is worse than the illness. The illness is death. How can the cure be worse than the illness if the illness is potential death?
But what if the economy failing
Worse than death?
equals death? Because of
it
mental illness,
doesn't.
the people stuck at home.
No, it doesn't. It doesn't equal death. Economic hardship, yes, very bad, not death. Emotional stress from being locked in a house, very bad, not death. Domestic violence on the increase, very bad, not death. And not death of someone else.
So yeah, what are some thoughts that you have after watching something like that?
I think the governor's correct.
Okay.
I think he makes a really valid point that what we're dealing with COVID-19 is in fact the impact on other people, whereas the distress associated with loss of income, financial hardship, isolation, domestic violence and other sorts of abuse that we will see, including alcohol abuse and drug abuse, we will certainly see all of that increase, but that's individual distress. I think the point that he was making is that this disease has no cure, and if you infect someone else, not only is it potentially fatal or lethal for you as an individual, but potentially for other people in the community or the other people in your family. So the point, though, is that regardless of that, a crisis like this adds a layer of distress that otherwise wouldn't exist for many people. For example, losing their jobs because of this circumstance. So the risks around mental health illness or mental illness and heightened risk of suicide are certainly going to be a challenge for our community as we move forward.
And that's what I think, like, you can take obviously what you just said out of what he's saying, but there's like underlying, I guess, there's an underlying discussion not being had with what the long-term impacts will be for all the people that have lost their jobs, for all the people that have lost their dream businesses that they spent their whole life setting up. Obviously, the increase in substance abuse that's going down, like the statistic in America is 400+% increase in alcohol consumption just from wine alone, from wine sales online, like you said, domestic violence, like all these types of things are going to be already going on right now. That it's not being talked about because news is obviously shaped towards one particular story at the moment. So we're missing out on what is going on right now currently. But in the long term, you can see that, like obviously what he's saying is, you know, he's trying to save people's lives from the virus, but there seems to be some sort of discussion that needs to be had regarding the bigger impacts that might happen from this huge lockdown that's changed everybody's life.
I think it's fair to say that in Australia we're seeing some very significant initiatives to ensure that people's distress is limited or at least reduced and contained. Some of the initiatives around JobKeeper and Job Seeker support initiatives that are meant to address some of that distress that would be caused by financial hardship. It doesn't resolve the issue, but it goes some way to supporting people through a pretty dark and terrible time economically. The issue of social isolation, I think, is another complicated issue, and we're seeing, at least in New South Wales, some shift away from 100% isolation. If you think about older people, who are probably the most vulnerable cohort of people through this virus, one of the things, firstly, they're more vulnerable to the virus. Secondly, they are more likely to get the illness in a much more heightened fashion. And thirdly, because of the fact that they're living in communal areas, often they can't have access to their families, they can't see anybody. And so for that group of people in particular, the issues of isolation are exacerbated. Their loss of control, the fact that they can't speak to their families, the fact that they don't necessarily have access to technology to stay connected. These are all major issues. But what we're seeing in New South Wales is a recognition of that. We're seeing it across Australia, but certainly in New South Wales, the first opportunity that they've had to start to release some of the restrictions, we're seeing that occurring, still protecting the community, but at the same time recognising that people need human contact in order to stay well, and particularly mentally well. So yes, look, I agree that the issues of social isolation, the issues of financial hardship heighten the risks. However, we're living in a society where there's very deliberate steps being taken by the government of all colours and at every level to ensure that people are A, safe, but B, as connected as they can be.
On top of that, though, it's not so much like, say, the JobKeeper initiative that's going on in Australia, where people are getting given X amount of dollars per fortnight. People want to be doing things as well. So taking away their freedom to go to work, where they often, people will complain about going to work, but right now they're realizing, well, I kind of like to just have that routine where it gets me up each day and I go and I complete certain tasks. So it's like there are those types of initiatives that are helping people get through this time in regards to money, but there's a portion of our life that's where we've all lost, where people start to feel disheveled, I guess.
Yeah, look, I think one of the things that is core to humanity is having a contributing life. And right now, because of circumstances, many of us, that contribution is being stopped because we're trying to protect the community from a terrible disease or an illness. Yeah. So yes, that's absolutely right. People's feelings of not being able to contribute in the way that they best can will exacerbate their feelings of loneliness, their feelings of worthlessness, etc.
Yeah. So what kind of things is your organisation doing at the moment? Is there different processes coming into play? Is the government contacting you?
Yeah, but we're working very closely with our member organisations and the government to put in some measures to ensure that there's appropriate services as well as supports and protective factors for people through this particularly difficult time. We've seen in recent weeks a significant increase of funding to establish a dedicated COVID-19 crisis line through Beyond Blue, and that crisis line went live about 2 weeks ago. And what we are seeing is an increase, a very significant increase in calls to crisis centres. So as an example, Lifeline Australia has received a more than 40% increase of calls to their centre. And the types of calls are varied, certainly distress around loss of jobs, but also issues to do with domestic violence, alcohol abuse and drug abuse, as well as the challenges of, as an example, homeschooling while still trying to work for those people who are working from home. So the issues are, quite complex, and we've been working closely with government to ensure that the right funding goes to organisations to increase the supports that are being given. There's been a significant investment also in perinatal and postnatal supports for women and men who are either expecting a baby or have had a baby. These are very vulnerable times in people's lives, and to be totally isolated at a time like this exacerbates some of the issues associated with that change of life that's happening for them. And certainly we've seen significant investment into those sorts of programs, which is great. One of the things that we are working with government is around the return to normal life, because for a lot of people this shift in the way they're working, the way they're living is going to be hard to come out from. If you have, as an example, somebody with a significant mental health or mental illness around agoraphobia, as an example, or claustrophobia, or any of those more complex psychological problems or challenges, for them to actually move beyond where they are now is going to be very difficult as well. So there's a whole host of complications that can occur from this forced change in the way we live for people who are either feeling disconnected or feeling protected by the fact that they're enclosed in four walls. So there's a lot of work to be done, and certainly as we start to build the bridge to going back to a more normal way of living, or the way of living we had before, we need to make sure that the right supports are available for people as we transition back.
At least we'll all be in the same sort of boat when we all go back to the normal, where we start to socialise again. We'll have we'll be a little bit socially inept for a while, and then we'll kind of just adjust and go back to that.
I think it will vary by individual, because for some people, the fact that they can't see their friends, or they're having Friday night after work drinks via Skype.
That's a big one gone.
It's it's just not the same. So for some people, there is an absolute thirst to get back to normal, and the risk is, of course, that people will step outside the rules because of their desire to get back to normal, and that certainly could see us going backwards from a health perspective. So I suppose that that whole complexity of the health of our community, physical health of our community as one, the financial health of our economy and our people, and thirdly the mental health of the community are key considerations for government as we go into progressive stages of protection, as well as then coming out of those stages of protection back into a normal lifestyle.
We are pretty lucky in Australia too. It might sound bad to say, but just even in regards to how spread out we all are, our country is quite large. It's the size of the United States, and we only have 26 million people. So that's going to be a defining. You go ahead. You got something?
There's some significant advantages to living in this remote island on the the very tail end of the globe on the Antipodes. And I think one of the key advantages is that we can control our borders a little more than, for example, European nations. So that is a huge advantage for our country, that our borders are more easily protected than other countries. The other advantage, of course, is the fact that we don't have the same density and the same level of density. The way that people live isn't as dense as it is in Europe or the United States or many parts of Asia. The other advantage is we've got a world-class health system.
Yeah, that's what I want to talk about.
Yeah, not only a world-class health system, but a world-class mental health system. Yep. Now, that's not to say that it couldn't be better, and certainly my organisation, among others, lobby very hard to improve our mental health system and our health system to support people, and our financial support systems to ensure that people are living the best life they can. But that said, we still have a world-class health system. And if you consider the experience of some countries, and Italy is a case in point where they don't have a mental health system to speak of. They certainly haven't focused on training psychologists or psychiatrists. It hasn't been an issue that country has seen as a priority until now. And certainly with the issues of social isolation, they're seeing a significant increase in demand for crisis lines, demand for psychology services, and they simply don't have the people, they don't have the infrastructure, they don't have the trained personnel to support their community through such complex times. So, we're lucky on many levels. We're seeing a lot of people in places like Italy, older people in particular, taking their lives for fear of infecting their families. So it's, that they don't have the supports. They're frightened about how they might impact their family and their community, and feel that the only option for them is to check out. So it's, very complicated times.
Yeah, for sure. So what kind of things have you been doing to help yourself? Obviously, people that don't know you, you're an introvert by nature. So this isolation has been kind of good in a way. You've been able to be productive still, and you still can obviously do your work.
It's been a gift.
Sorry?
It's been a gift. It's difficult to say that when, many of my friends, most of my friends are really struggling with not being able to be in contact with others. Many have lost their livelihoods, particularly in the arts. People just cannot work, and their entire careers are basically on hold. Their income is frozen. They don't have options. They can't even really do online programs, as an example. Their craft requires multitudes of people, so they simply cannot do it. So yes, I have to say that I'm surrounded by people who are doing it very tough. But certainly physical activity helps people, keeping connected and being in touch with people. I'm fortunate enough to be able to continue to work. And although some days you finish the day quite trashed from sitting on the end of the Zoom, it certainly allows me to feel like I'm still contributing. I have to say the other thing that keeps me on an even keel are my pets. And it's hard for someone like me who didn't have pets up until 12 months ago to say that that's one of my points of sanity. So that's important. And look, physical contact with people. So doing the things that I can do within the rules, and taking advantage of every opportunity to go for a walk or and take up hobbies. I mean, I've taken up hobbies that I didn't think I would. And so that's certainly keeping me occupied and balanced.
What's an example of one of your hobbies?
Sorry?
What's an example of a newly uptaken hobby?
I'm embarrassed to say, knitting.
Do it. I think I know it, but say it anyway.
Knitting.
Knitting. What are you currently knitting?
Know. Yes, I'm knitting jumpers. I have knitted scarves and beanies, and now I'm knitting jumpers. But what are you doing, Hayden?
Well, I was going to say one thing that I have been doing is, which I was going to ask you, is what you're doing about your schedule, because obviously everyone's are living in irregular hours. So how are you going about scheduling meetings, scheduling your whole day? Do you have a diary that you're keeping?
I'm fortunate that I've always been very diary-centric. So for me, this is more about the discipline to stick to the diary and not continue to work after the end of the day, but simply shutting my laptop and physically moving it. I have to say the first 3 weeks I was a disaster. I really struggled to get into it. Yeah, I really struggled to get into a routine. It was difficult because I was used to walking to the train station and there was a routine, and all of a sudden that stopped. So my commute was from my bedroom to my library rather than to the train station and all the way into the city and so on. So that really did challenge me to stay disciplined. But I have to say, having realised that, just forcing myself at 6:30 to close my laptop and put it to one side and move from my position in front of my work laptop to my home laptop is enough to switch my thinking, because the risk is that you can very easily fall into the trap of working continuously and not taking advantage of the fact that you've reduced your commute or whatever it happens to be. I have to say I spend a lot of time speaking with my team about what they're doing and how they're coping, and many of them are taking breaks in the middle of the day. So they've moved their exercise from the morning or the evening to the middle of the day so that forces them to get out and move. And I think that's not all employers would be as focused perhaps as we are on those sorts of things, but certainly ensuring that our employees are looking after their physical and mental health is important to us. We deal with a pretty tricky topic as part of what we do, so making sure that we're as balanced as we can be is important.
Well, I hope you've been enjoying the episode so far. You can jump on panosophy.com to let me know your thoughts. If you've got any questions specifically for Nieves, you can head to her organization's website, suicidepreventionauster.org. You can also hunt her down on Twitter at Nieves Murray. We're going to be continuing the discussion inside part 2, so if you'd like to finish off, make sure you join us there. And thanks so much for tuning in, and I'll talk to you soon.